so I want to spend 15 minutes playing devil's advocate on this issue of vaccine mandates. Sound good to you?
15 minutes of devil's advocate? Sure.
Okay, let's start. It's my understanding this mandate applies to about 12,000 City of Seattle employees. Do you have any idea how many of them are actually not vaccinated?
We think the majority of our employees are vaccinated, but the context is everything on this. Right now, the City of Seattle is probably the safest city in America. We have almost 83% of people who've started at least their first vaccination. But if you compare where we were last December or August with where we are now, we haven't had anyone die of COVID in the City of Seattle for over a month. We were having at least 2 a month during this time last year. Vaccines work. And as a city, we've got to be committed to making sure that we not just make ourselves safe, but that we're protecting everyone else. We know without a doubt, Brandi, that this is a pandemic of the unvaccinated now. That is what's driving the numbers. And the thing that I fear the most is the population that is most unvaccinated, not by choice, are those people who aren't eligible for vaccinations, our children. And if we want to protect our children, everybody else has a duty to get vaccinated.
But at the onset there, you perhaps articulated one of the arguments against this. Seattle is one of the most vaccinated cities in the country. You haven't had anyone die from COVID since July 11th. Why then would the government mandate that potentially hundreds or even thousands of people would have to put a needle in their arm when they don't want to in order to keep their jobs?
We know vaccinations work, and we also know that this virus is voracious. If you are unvaccinated, it will find you. And we're in a very different situation now as we're looking forward to schools opening up again. Last year, Seattle Public Schools didn't open until the very end. And even when they did open, we were largely still a work from home. Most businesses shut down. We're now coming together in ways, and there's no border at the City of Seattle. People come here from all over the world, from all over the country, and from all over the state. If you're vaccinated and you are exposed to this virus, your chances of having significant disease are clearly diminished, but you can still carry the disease and give it to others. We want to protect our kids. We want to protect the people of Seattle. We want to protect those most vulnerable. And that means doing your part in getting vaccinated. Now, there is an exception. If someone has a generally held religious objection or a medical reason why they can't get vaccinated and they can document that, we won't require it. But other than that, it is really a matter of public safety, and it's a matter of civic duty, protecting the people around you.
But again, as it pertains to protection, going back to my question, Seattle is one of the most vaccinated cities in the country. King County is one of the most vaccinated counties in the country. You haven't had a death from COVID-19 since July 11th. We have met and exceeded the goal you set for the city when it came to vaccinations of 70%. So why then would the government feel the need, when we haven't had a death since July 11th, to mandate that individuals put a vaccine in their bodies that they clearly do not want to receive?
Again, it goes back to what are people's obligations and what is our obligations to make a safe workplace. We know that vaccinations work, and we know that if we jeopardize the safety of people in our community, it has impacts on a whole range of other people. When someone decides not to get vaccinated, they're not just deciding they're willing to run the risk of getting sick. They're saying, I'm willing to run the risk that I'm going to make you sick, or I'm going to make a coworker sick, that I might have to go to the hospital. We're seeing hospitals fill up again in the state of Washington. Excess patients come here to Seattle. There's places in the state where the ERs are so full that if you're in a traumatic car accident, you can't go to the hospital. So this is not just a matter of what a person's individual liberty is. It really goes to the social contract of what we should be doing together. We know that that is important. We know it's a matter of public safety. And we are seeing now that this Delta variant is more infectious than we've had before. It will expose more people. It makes them more sick. And we're now seeing nationally that it's having a much greater impact on children. More and more pediatric hospitals are showing kids coming in with serious disease.
You've mentioned school getting back in session. You mentioned the risk to kids who aren't eligible for a vaccine. One of the only state workers that aren't subject to this are teachers. If we're so concerned, why would that be the case that teachers do not have to get a vaccine, but people in other jobs do?
As you know, there's separate elected government entities, and I'm not in charge of Seattle Public Schools. Those workers work for Seattle Public Schools of the various school districts. So I really think those questions have to go to the schools. I think that we know that vaccinations work. We had a great partnerships with Seattle Public Schools, and because of that, our 83% vaccination rate includes those 12 and older, because we went into the schools and used that place to make sure that we could get people eligible vaccinated. When the age is lowered again, we'll partner with them again. So I think what their rules are for their workers, you have to ask them. But I think that government has an obligation. First and foremost, we serve the public. And you can't serve the public fairly and safely if you might give them a disease that could kill them.
So do you believe teachers should be mandated to get a vaccine if everybody else is?
I think it is important that those people working with our children and most vulnerable populations get vaccinated. And so we know right now that that's going to be schools in large part. So I think the school districts right now are looking at how to do that, whether masks are sufficient enough. But again, yes, I think that teachers should be vaccinated just like nurses and doctors and people who have that first line duties to take care of the most vulnerable. And unfortunately, right now, our children are the most vulnerable population and it's not by choice, it's because they're not eligible for the vaccination yet.
You talked about people who are not getting vaccinated, making that choice for others. Their decision not to get vaccinated could have a negative consequence on someone else who is perhaps not eligible for the vaccine. One of the prevailing arguments against this mandate that I have heard from people on the right is that people on the left often talk about a woman's right to choose what happens with her own body, yet here you are mandating what other people do with their bodies. What do you say to that criticism?
They are not at all related. And again, you gotta follow the science. Forcing a woman to make certain choices about her individual health that don't impact her coworkers, her neighbors, her children, her doctors, her patients.
But they would argue that it impacts her unborn child. I'm telling you, devil's advocate, what people on the right are saying.
So I think that, I think these arguments are making something that is a healthcare decision about safety and trying to make it a political decision. And I think that's irresponsible. I think that as an American, you should be doing everything you can to protect everyone in your community. And if you decide to make the selfish choice not to vaccinate yourself, it'd be fine if you lived on an island and you came in no contact with people, but you don't. You come in contact with family members, children, or people in the grocery store who then go back to their children. You have to go to the ER. So it is undisputable what this virus does. If you look at the data on the areas where people are not vaccinated, no one can make the argument that it isn't impacting communities. You just can't. It's just a fact. So this isn't one side of the divide or another. There are some truths in society. And one of the truths is this virus, if you're unvaccinated, it will find you. And if you get sick, you will get other people sick and you will have to go to the hospital.
In talking about truths, again, I go back to one of the other truths is we are nowhere near when it comes to hospitalizations and deaths where we were last year at the height of this pandemic before people could get vaccinated. We have met and exceeded your goal for vaccinations, haven't had a death since July 11th. So I think a question people have is, where does this end? King County Executive Dow Constantine said yesterday, I quote, "A healthy King County depends on every eligible resident getting vaccinated." So should we expect that this will stop with government employees? Or if every eligible resident needs to be vaccinated in order to ensure the county is healthy, should people who don't work for the government be expected that soon you will mandate they get a vaccine?
So, rather than go to like, what is the most extreme thing here?
I'm not saying extreme. This is King County Executive Dow Constantine. He's saying a healthy county depends on every eligible resident getting vaccinated.
Yeah, and I think that makes sense. I mean, look, if, we've compared this virus at times to other great challenges for the generation. People try to compare it, for example, to World War II and what would you do? If in London during the Blitzkrieg, if you knew the bombs were coming, would you get into the shelter? And if you didn't, it's irresponsible. And if you're not doing it, jeopardized other people. So again, this isn't just about individual choice. This is about choices that impact everybody else in our society. And while the numbers are down in the city of Seattle, we are the ones that are lifting the whole state up. And we know that people don't stop at borders, Brandi. Again, remember, this whole epidemic started here from 1 or 2 people traveling here from China. I mean, think about that. And so our job as government is not just to be focused on what's going to happen today, but how do we make sure the virus doesn't get out of control tomorrow? And what we do know is we have a population of people who are most vulnerable to that virus, and that's the unvaccinated. We want to make sure that the people who have the choice to make that not true, make the right choice, because if they don't, they're making the choice for other people, and that's not right or fair.
And again, this is about playing devil's advocate for a decision. It is incredibly important to press elected leaders on a decision to mandate that around 500,000 people get a vaccine that up until now, some of them have chosen not to receive. I always start every segment on vaccinations by saying, I have received a vaccine. I did so at the first available opportunity, but I've also spoken to public employees, including some of your employees who do not want one. And that brings me to the Seattle Police Department. We are at a time of record low staffing, at a time when crime is going up. Do you mean to tell me that come October the 18th, you will fire Seattle police officers who do not have a vaccine?
My best, what I believe is going to happen is most police officers are going to get this vaccination.
But if they don't?
What I have seen and see, Brandi, you can have your hypothesis. Mine is the opposite of yours. Mine is that I've seen in the last year, Seattle Police Department is working harder than it's ever worked under some of the most difficult circumstances to serve the public. And they do it at great risk to themselves. And so I believe that people, when faced with the choice on, is this important to the community, are going to make the right decision. And people can take, any extreme example they want and say, but what about this? Would you do it? I really believe that people are going to respond. And the basis for that is because they have so far. Every time we've asked people to do the hard things in this city, they've stepped up and done it. And I believe the workers will do that as well. And so we will have exceptions. Like I said before, if there is sincerely held religious belief against it or a medical reason that you can't get it. But otherwise, we have to make sure that as we serve the public, we aren't in the position that maybe the people that actually make the public sick. That just isn't right or fair, particularly when we know 12 and under cannot get vaccinated. So if they get sick, they will not have the protections that the vaccine gives, which is not just the protection of preventing illness, but making sure it's not extreme. And so I'm asking every city worker to do the right thing for the children in our city. And I believe they'll step up.
Respectfully, it's not an extreme thing for me to say, are you going to fire SPD officers on October 18th? That is what you have put forward, that get a vaccine or you might not have a job on October the 18th. And it's also not a hypothesis. I have emails from Seattle police officers saying, I will not get the vaccine. I am willing to lose my job. So again, come October 18th, for SPD officers who decide they are not willing to get the vaccine, will they lose their jobs?
It is your hypothesis, Brandi, because
it's not a hypothesis. I have emails from officers saying, I will not get it.
Well, I've heard officers say, now that I realize the danger, I will get it. So we'll see what they do. We've got till October. And I believe the police officers that I know, that I've talked to, that I've worked with over a career, they believe in service. And those people will step up and do the right thing. I truly believe they will. And look, it's a different thing in some ways, but we had these same debates when I was a child about seatbelts. People said over and over again, it's my right not to drive without a seatbelt. And we as a society decided no, because you don't just jeopardize yourself, you could jeopardize other people. You've got highway patrol, you've got first aid that has to come. The same with high speeds. People still say, if I want to drive 100 miles an hour, I should be able to do it.
Madam Mayor, a seatbelt is not injected into your body. And again, I have the COVID vaccine. I had no problem getting the COVID vaccine, but it's not my job to sit here and to praise the decisions that you make. It's my job to challenge them. And I'll go back to the question before. It is not a hypothesis for me to say that officers aren't going to get the vaccine. I am staring at an email from an SPD officer who says they will not get the vaccine. That is a fact. I know this officer. So when I ask you, will you fire officers who don't get the vaccine by October 18th? What is your answer to that, ma'am?
I don't believe I'm going to be put in that position because I believe officers will get the vaccine.
Let me ask you this. I asked you at the onset of the pandemic. We've had many interviews, you and I do appreciate even knowing the subject matter and that you were going to get some pushback today, you taking the time to discuss it. One of our first interviews, I asked you about the delicate balance between protecting life and preserving liberty. That was at the onset of the pandemic as people were going through these unprecedented mandates of being required to stay at home. What would your answer be to that today? Do you believe that you are still on the right side of the line between protecting life and preserving liberty?
100%. In fact, I think that this decision is far less intrusive than some of the other decisions we had to make. We now know scientifically it is proven that this vaccine works. And it is a way to prevent this virus from infecting you. And if it does infect you, in the rare instance that it does, the chances of serious illness or death are really tiny, less than 1%. And so we have something that fights and beats this virus. If we don't take all steps we have, then we won't be able to do the other things that we all enjoy and want to continue to enjoy. We're lucky here in Seattle because people have stepped up, like we've talked about, the highest vaccinated city maybe in America, but you don't have to go very far out of Seattle. Pierce County has only about 50% of the people vaccinated. Do you think people travel between Tacoma and Seattle? Of course they do. Tri-Cities, Spokane, and then you go into other states where the statewide ratio is 30%. We need to do what for America and for our communities, what the right thing to do is. If we want to have the individual liberties that we love, getting together with friends, opening our businesses, going out in businesses, being together, that means we got to be smart now. And that's why I think your hypothesis, people are acting, I think there's always this strong reaction, but then when you give people the facts and let them do the right thing, I have seen over the last 18 months that people do the right thing.
I want to give you an opportunity to reiterate some things that we've discussed. You know, vaccinations are not a panacea. I am coming to you from my house today because I had contact with an individual who was fully vaccinated, yet still contracted COVID-19. I am fully vaccinated, yet the risk of possible exposure of me getting it as well is enough where I am at home today. So we know that vaccines, even if we had 100% of the population vaccinated, are not a panacea. So I think the question people have is, where do these mandates end? We have met and exceeded where you want it to be for vaccinations. We haven't had a single person die of COVID in a month. So when are you satisfied that citizens and workers have done enough to be able to move on?
So Brandi, first I want to finish the conversation about liberty. I think the people who are saying it is my liberty and my right not to get vaccinated, forget that they're making the choice for the people who can't get vaccinated. And I want to say again, the more people that get vaccinated, the rarer there will be what you just talked about, the breakthrough cases. We know that these breakthrough cases happen in a very small number of people. But when you get it, you can still transmit it. So the more people that are vaccinated, the less likelihood that we can transmit it to people who cannot get vaccinated. And that includes every child under the age of 12. And so as people are making the decision for their own liberty and their own, I don't want to get it, I just want them to be really cognizant to know you're making that decision for everybody's 12-year-old, 10-year-old, 11-year-old, and infant. Because if you do contract it, you can spread it. That's just a fact. And so what is the end? The end means that we don't all talk about who has to do what. Again, what I have seen over this last 18 months is the prevailing voice and the prevailing action is not the what about me-ism, it's the how do we help each other-ism. And that's how we're going to continue to get through this and actually beat this virus.
Just one more to put a fine point on it. More people have been murdered in your city this summer than have died of COVID-19. More people have been shot and killed in your city this summer than have died of COVID-19. Is your focus on the wrong thing right now?
I'm focused on both. That's my job as mayor. But I think we all agree, Brandi, these last 18 months, what this virus has done to our society and our city and our country, None of us want to repeat it, and none of us want to go backward. It's been too long and too hard for us to go back now. And we are seeing, you know, right now it's the Delta variant, but we're seeing new variants being bred in the Southern Hemisphere. And as those come and people are more susceptible, they will come. And the best protection we have against this is this vaccine.